Last presentation, not least for this panel, which is a context-setting panel. These are all things that we thought were important for all of us to understand before diving into the more environmentally focused and science-focused conversations about particular cancers and potential linkages. So this is Jamil Bey. Hi, Jamil. Thank you for being here. Jamil is the president and CEO of UrbanKind Institute here in Pittsburgh. And as a researcher, analyst, and consultant, he specializes in challenging common assumptions about ordinary concerns while bringing alternative perspectives for consideration. And looking forward to hearing what Jamil has to say. I think Ted's pointing out about poverty, racism, inequity being elements of minimal conditions for cancer is an extremely important foundation for any conversation around cancer, and Jamil's here to bring us that perspective. Thank you.
Good morning. All right, so as I'm preparing for this, and I got the invitation, and I see the list of folks that they want me in this section with, there's epidemiologists and medical doctors, and me, I'm a geographer. And so I'm thought, well, what am I going to talk about relative to the disparities and inequities? And this was the title that was given to me, and I said I'll play with that, but that was the title that I was assigned. And Molly or Polly was it we can work with. I said we'll keep it. But as I'm preparing for this talk, and I'm thinking, what am I possibly going to say or present that adds a perspective that's not already here so far? What am I going to, how do I follow the epidemiologists when they talk about risk factors? And so I could have prepared a slideshow that showed a list of negative health outcomes associated with places. We've seen charts and maps, and we'll see some others later in presentations that highlight disparities in Pittsburgh, in the county, and some other stuff from other cities. But going from this title, I could have presented slides that showed rates and occurrences of various cancers, asthma, life expectancy, premature deaths associated with long-term exposure to particulate matter. And another slide could have shown, common list of pollutants and talk about the parts per million or exposure levels of sulfur dioxide and benzene. And we've seen all that. And so I said, well, what am I going to add to the conversation? Most of you folks already know that. So if we take what we've seen and we see the trends and we see what folks are exposed to, then you add race and the history of race in this country, and it's that much worse. Okay, so everything that you've seen, when we talk about disparities, add race to it. And we see that it becomes a whole lot worse for those, once we do that. And we know that exposure to carcinogens and other toxins are bad for people. And in most cases, the challenges of reducing exposure and limiting risk are far greater. So it's the challenge of reducing those risks are greater for Black, brown, and low-income, low-wealth families and communities. So that's it. I don't have anything else to talk about. No. So what I want us to, so here's what I think I can add to this conversation. What I want to do with the remainder of the time is to challenge you to think and act differently when it comes to the topic and your good work, so that together we can make a difference. And it starts with how we frame problems. So let's start with that. How do we frame this problem of disparities and inequities relative to risk factors and outcomes? So one problem, think about this, and every speaker so far has mentioned this. In 1965, Congress passed a law requiring cigarettes to carry a warning. I wasn't around then. So before I was born, but my whole life I've seen people who still start smoking today. And we've talked about the reduction, but just warning folks that cigarettes will kill you has not prevented people from smoking cigarettes. And that's been our primary strategy for decades. And it wasn't until about a decade or so ago that they got a little more aggressive in messaging that and changing the narrative around smoking that we began to see that difference, ramp up or ramp down, however you present it. But it's not just about warning folks that smoking's bad and these other things. It's not just about education. So we can understand the problem. We understood the problem about smoking to be the lack of information about the negative impact of smoking, which is why we framed it in that way. And that took so long, and we're making progress, and we don't want to discount that, but we're not there. And I'm not going to go into the rabbit hole over cigarettes. The simple point being that warning alone is not enough. We must get some social scientists in on this to help us better understand human behaviors and decision making. And when we get to the recommendations part of the conversation, we need to make sure that social scientists are included in helping us think about this. So back to framing the problem. Disparities and inequities, reflections on risk factors and outcomes in frontline communities. So frontline, and I've seen as also fence line communities. These are communities that are within a specified distance from a known industrial pollution hazard. This proximity contributes additional risk factors specifically related to potential for exposure. Okay, so if you live within a distance, so the folks in Clareton and the Mon Valley are exposed to U.S. Steel's poison, and they don't have the resources to move. So these are frontline communities in this conversation. So here's the narrative or the problem frame. Let's go back to framing this. So African Americans, Latinos, immigrants, and low-wealth communities are too consumed with the day-to-day stressors of low wages, discrimination, quality food access, substandard housing, low poor, blah, blah, blah. They're so consumed by these things that they have little time to pay attention to health and environmental issues. Have you heard that before, or some argument similar to that? That the day-to-day challenges of just living with these stressors makes it too difficult to prioritize health and environmental issues. So if this is true, that folks are too concerned with the day-to-day issues, if that's how we frame the problem, the issue to consider is exposure. Then a reasonable recommendation, and I just saw this in one of the papers I was reading to prepare for this, would be to urge clinicians to work with their patients to ask about and identify exposures that may impact their health. So the goal is to create an exposure history. Have you seen any of this stuff? So by including questions related to environmental and workplace exposures when asking about a patient's history. So this may make sense. So as I'm reading about that, and I'm thinking, okay, I can see where that could be effective. But then I thought that there's something missing from there. There's some assumptions in that approach that may make it more complicated. So let's go back to disparities and inequities. So for those of you who are clinicians in our audience, how easy is it to get reliable information about housing, lifestyles, job history from your patients? Particularly African American or Latino or immigrants, do they readily volunteer this information to you? Anybody? Yes? No? It's not easy. It's not so easy. And this is not to offend anyone, but there are many folks, particularly African Americans, who do not trust the medical establishment. And it's not personal, but there's an ugly history and some hurt that has not been reconciled. And it's rampant in the Black community. So our history of engagement and treatment in the U.S. has made it so. So it impacts everything from immunizations to not scheduling checkups to the high frequency of emergency rooms. Folks ignore early signs and wait until the pain is inevitable. So, this is a trust disparity. That when we're talking about disparities and inequities, what's that look like, and what is the role of this profession to help overcome that? That's something that's in your power that we can do. So let's connect this back to the framing problem. So the challenge is not only to provide information about environmental toxins so they can do better, but we should ask questions about how to eliminate the threat of exposure. And Dr. Shetler, I think, was talking about some of this. That's not within the power of the African American community, limiting the threat of exposure. So there are systematic challenges working against us here, which gets me to the second point that I want to leave you with. Those of us who have the privilege to concern ourselves with issues related to health and environment and nutrition, we have to do a better job of creating narratives around these issues. So it's not enough to publish in journals and speak to conferences about the magnificent work that you do. How do you take that work, and I think this was in your opening, how do we take that work and put it in the hands of folks who can do something to make a difference. What would it take if we sort of in a space like this, in these interdisciplinary spaces, how do we join circles or networks of folks that may include artists and activists and nonprofit leaders or people who can translate and activate your work for everyday folks? When was the last time that you used your privilege and power to write a letter to the editor of a newspaper when you see bad narratives that are inconsistent with your findings? It's okay to call bull publicly. They do it all the time on the other side. And so consider that there are elected officials who would do the right thing if they had better information and a supportive public to back them. We need to engage that and own that and make sure that that's in the hands that people can understand. So creating a narrative that says that we can protect the environment, have a strong economy, and a high quality of life. So right now, we don't believe that we can do that because that's not the narrative. That we believe that we have to make a trade-off. If we want environmental protections, we're sacrificing jobs. And we have to sacrifice health to do that. That's a false narrative. And we need to challenge that. So Ted mentioned the need to focus prevention exclusively, not to focus prevention exclusively at the individual level. That I'm missing a page of notes. That's all right. Not to focus prevention exclusively at the individual level. So what are we doing as a society or as an economy that contributes to cancer and cancer proliferation? What are the implications of this wave, this narrative of deregulation of industry? What does that mean? Of course, industry wants to cut regulations so that they can maximize profits. Those regulations typically were put in place to protect people and or the environment. So the idea that we should embrace an agenda to deregulate without question, that's where we come in. That's where we have the power to challenge and change those narratives. It's just stuck. So in the real world, I would have spent a whole semester working with you on this one issue. But instead of 15 weeks, I only have 12 minutes. So let's get through this quickly. So if we adjust our frame and the challenges and inequities and disparities on fence line communities. So here's a narrative. Let's see how we do with this one. The life-threatening burdens placed on communities of color near industrial facilities are the result of systemic oppression perpetuated by these industries, which exposes communities to health, economic, and social hazards. All right, so what if that's the narrative? There are life-threatening burdens. U.S. Steel, I don't know, let's call them out. But not just U.S. Steel, Shell, Exxon, name them. Bayer, they're all guilty. The life-threatening burdens placed on communities of color near industrial facilities are the result of systemic oppression perpetuated by these industries, which exposes communities to health, economic, and social hazards. Okay. Many of the most vulnerable communities are also plagued by legacy policies that permit legacy polluters to continue to contribute to negative health outcomes. This building that we're in, the Phipps Conservancy, its history goes back to money that Henry Phipps made in his relationships with Andrew Carnegie. The history of Pittsburgh is steel. And the folks who live here in this city, it's not an easy challenge to take on because it's attached to our identity as a region. And United States Steel and Andrew Carnegie's legacy and all of the wealth from Frick in this community but we have to do something different. What's a new narrative? Well, this is your legacy, but this is also your legacy, and we have to challenge that. And how do we do that without your help? And without changing the narrative and removing it away from people who are subjected to carcinogens that they didn't create and who live in communities that they were redlined and gerrymandered into, or not gerrymandered, but pushed into. What's our role in changing that? So in this last part, so as I summarize, if we frame this narrative this way, and we call out the polluters, and we call out what they're doing is life-threatening, okay, it's, the things that jumped out from this give us some new areas to direct research and to target solutions. So life-threatening burdens placed on communities, systemic oppression. Let's acknowledge it, it's real. Perpetuated by industries. Let's call them out, make them the target. The health department is responding. They didn't do it. Our legislatures have not created policies that protect us, and have not empowered the health department to do what it needs to do to regulate U.S. Steel. You know, and we talk about these things as if they're natural hazards. You know, industrial hazards are not natural hazards. We can't prevent a tornado. It's going to happen on its own time. But we can regulate polluters if we had the political support. So this is the power of new narratives and the potential to reduce disparities and inequities and reflections on risk factors and outcomes in frontline communities. So those are my recommendations. Let's change our narrative. Let's work with us as a team. Let's do some integrated, interdisciplinary work to achieve better outcomes, and let's remove the burden from those people who are most impacted. Thank you.
Thank you, Jamil. Really important perspective to carry with us throughout the day.